Hello viewers, I'm Dr. David Ikudayisi, a board certified internal medicine specialist in US, and I'm also a regenerative medicine specialist. I'm here to educate you on regenerative medicine. For those who are not familiar with the term regenerative medicine, it's a new branch of medicine that aims to restore normal functioning of the tissues and cells and tissues in the body of the area of that body that has been damaged either by disease, age, or due to congenital conditions. Now, regenerative medicine comprises platelet-rich plasma therapy and stem cell therapy. The stem cell therapy can also be divided into three areas, which is embryonic stem cell therapy, induced pluripotent stem cell therapy, and adult stem cell therapy. The first two that I mentioned, they are still in research stages because of the possible side effects that they may pose to human beings. But the third one, adult stem cell therapy, is gaining popularity due to the fact that it has been proven to be safe, although there's still a lot of studies and research going on. But today, it's still possible to use adult stem cell therapy to address some conditions or issues that the orthodox medicine have already said there is no further cure or treatment available. Now, I would like to also explain what platelet-rich plasma is, because some people may not be familiar with what this is. Platelet-rich plasma is when you use a patient's blood to treat the patient by first of all concentrating the blood and separating into plasma and red blood cells. There's a section after centrifuging the blood that is very rich in platelets. That is where the name platelet-rich plasma comes from, and can also be referred to as PRP, therapy. And what you get is that in that sample of blood, the platelets are being concentrated about 5 to 10 times more than the baseline, and that allows the area where you need it, to get the benefit of high concentration of platelets. As far as stem cell therapy is concerned, a stem cell is any cell that can self-replicate itself or differentiate into any matured cell. Now, there's been a lot of controversy about stem cell therapy. Keep in mind, this is just when people are talking about embryonic stem cells. And the reason of the religious or ethical controversy is because embryonic stem cell therapy involves using, let me say, embryons, which sometimes they are being donated by the IVF clinics, because these are all potential human beings. Therefore, there's a lot of religious reasons, controversy about that. The second type that I mentioned earlier, the iPSC, which is induced pluripotent stem cell therapy, is like when you take someone's skin to the lab, reprogram it, and make it maybe grow the nose, hair, or some tissue organ from it. That has similar characteristics like the embryonic stem cells, but they do not have any religious controversy, because you are not dealing with potential human being here, And then the third type of stem cell therapy that I mentioned earlier is called adult stem cell therapy. The word adult is not about age, but it is just referring to the fact that the source of that stem cell is from fully formed human. So that because adult stem therapy covers umbilical cord blood, bone marrow transplant sometimes is considered under regenerative medicine, and also fat from the abdomen can be a source of the stem cells. So to make it a little bit clearer, there are three sources of adult stem cell therapy, which is the only type of the 3 stem cell therapy that today currently have clinical applications. And those 3 sources are umbilical cord blood, bone marrow, and fat. So those are the 3 sources. I hope I've been able to break down or explain what regenerative medicine is all about. Next week we will continue by discussing what are the ailments, conditions that regenerative medicine can address. I'm Dr. David Ikudayisi, regenerative medicine specialist. Thank you.